Today, I would like to share with you a topic that is called herd immunity. I'm pretty sure you have heard this many times during this pandemic because it's everyone is waiting for um, vaccine, and then they will also ask about, oh, am I going to wait for herd immunity? So sometimes I wonder if we are going to have that, right? So let me explain and share with you what I know so you can understand and you can also take care of yourself. Okay. I'm now at home because I will eventually do it at my office, but I'm not quite sure what's going on today. And so I just rush home and just do it at home. So it's more relaxed, right? Okay. So at the end, after 20 minutes, I'm going to end it. Okay, so I'm going to watch my watch here, and I will then look at questions. Now, in the future, if you want to ask before I start, it's okay. Also, I think you can go to the YouTube and then type your questions. But right now, I'm going to just go ahead and present about 20 minutes of what I would like to share with you. Okay. So basically, herd immunity for coronavirus or COVID-19. Why this herd immunity is important? Actually, it's very important. But herd immunity is condition of when almost everyone is going to be protected from this virus because enough of population is immune. Okay, so herd immunity making the spread of the disease from person to person is unlikely. As a result, the whole community becomes protected, not just those who are immune, the whole community. And you probably heard about immunity threshold. So if a percentage of the population it must be capable of getting this disease, and this is called threshold proportion. So the percentage of population that gets the disease is called threshold proportion. And if the proportion of the population that is immune to the disease greater than this threshold, then the spread of the disease will decline. And this is known as herd immunity threshold. What percentage of immunity needs to be immune in order to achieve herd immunity status? It varies from disease to disease. The more contagious the disease is, the greater proportion of the population that needs to be immune to the disease is to stop its spread. For example, measles. Measles is very or highly contagious illness. It estimated that 94% of the population must be immune to interrupt the chain of the transmission for measles. So how do we achieve this herd immunity, the status of herd immunity? There are two ways, only two ways. One is vaccines and one is infection. Let's talk about the vaccine first, okay? A vaccine for the virus that causes COVID-19 disease would be an ideal, actually. Good, successful vaccines will create immunity without causing illnesses or resulting in complications. A good vaccine. Herd immunity make it possible to protect the population from the disease, including those who cannot be vaccinated. There are many people who cannot be vaccinated, such as newborn, because the liver maybe has not developed completely, and those who have compromised immune system. What is the drawback of vaccines? Protection from vaccine can wane over time, requiring revaccination. Sometimes people don't get all of the shots that they need to be completely protected from the disease, because some vaccines require multiple shots to complete. What is the challenge for this herd immunity? Okay. I mean, the vaccine, some people has an objection because of their religion. And many of these people who believe of this is against their religion, they live in the same area and they send the children to the same school. So they all do not want to be vaccinated. So they will not contribute to achieve they do not contribute for achieving this herd immunity, right? And then some people, they fears of possible risk, and sometimes they are very skeptic about the benefit of the vaccine. So they do not want to be vaccinated. Now, if the proportion of the vaccinated people in a community falls below the herd immunity threshold, the exposure to contagious disease will result in quick spreading. For instance, measles has recently resurged in several parts of the world with relatively low vaccination rates, including United States. Now let's talk about infection, the natural infection, you get infected, right? The herd immunity can also be reached when sufficient number of people in the population have recovered from the disease and have developed antibodies against future infection. Problem relying on these community infections, there are several. First, this is not yet clear if infection with the COVID-19 virus makes a person immune to the future infection. We don't know. We don't know very well what is this COVID-19 virus, personality. We need to research to determine the protective effect of the antibody to the virus in those who have been infected. It hasn't been actually decided what that one is. Now, after the infection, the researchers suggest that usually reinfection with the same virus is mild and only happening in fraction of people. It is possible after period of months or years, because now the COVID-19 is only just for a few months. So we do not know yet of these reinfected populations. Other problems would be like, even if the infection with COVID-19 virus creates long-lasting immunity, a large number of people would have to become infected to reach herd immunity threshold. So who is doing that? Statisticians who calculate, epidemiologists, infectious disease doctors, they all work together in a random study, okay? So the expert estimate that in US alone, 60 to 70% of the populations has to be infected. That's more than 200 million people would have to recover from the COVID-19 to stop this epidemic that becomes pandemic now. If many people become sick with COVID-19 at once, the healthcare system could quickly become overwhelmed, just like what we experience now in New York and everywhere. This amount of infection could also lead to serious complications and millions of deaths, especially among older people and those who have chronic infection or condition. How can you slow this transmission of COVID-19? Well, until COVID-19 vaccine is developed, probably, right? So it is crucial, though, to slow the spread. Because of that reason, just now I already mentioned about the hospital that can be very overwhelmed. Now, there is a study at Stanford Medicine by Dr. Yvonne Maldonado. I read about that. She explained why the claims about early spread have been overblown and misleading. They found out that there was no surge of COVID-19 before March 4th, 2020. So in December, November, January, we also had a high-level flu season with documented influenza disease. Okay, this is a time of the year when we see lots of respiratory virus and we actually diagnose those. Right now, we are at less than 5% of the population that has infection of COVID-19. You would need at least 10 to 12-fold that level to reach 60 to 70% infection. The only way to get to the herd immunity is to vaccinate people, or else we have a horrific transmissions, and we cannot do this. So we are going to have to continue some social distancing effort, right? We have to stop the spreads that goes fast if you don't do it. Cases do start tapering off eventually, but what we need to be careful is when the second wave comes along, which it will. Keep it more like, ripple than waves, right? As of last Monday, June 1st, California has 43,000 some positive cases and 1,700 deaths. Who benefits from herd immunity? Definitely people who cannot be vaccinated, or a larger scale. Herd immunity protects the entire community actually, because it slows or stops diseases from spreading. Number two, maybe vulnerable populations. Some conditions prevent people from getting vaccinations, and because of the legitimate medical reason. For example, it is very unsafe to vaccinate people with serious allergies or diseases that cause weakened immune system, like HIV, AIDS, or cancer, or newborn, just like what I mentioned. Even there are only few cases of the disease reported, we have to continue vaccination if there is. It is essential to maintaining the herd immunity. So that is if we have the vaccine. There are obvious benefits to herd immunity in the US. In the early 20s, about 200,000 Americans contracted diphtheria every year. 3 years later, they have vaccine and established the herd immunity. And between 2004 and the 2014, 10 years, there were only 2 cases of this disease, of diphtheria. Now in 64 and 65, US experienced a rubella epidemic that killed more than 12 million people, including 2,000 babies. The vaccine was introduced in 1969, 4 years later. And since 2012, there were only 12 cases of rubella. So in 8 years, only 12 cases compared to the 12 million deaths. The disease brought under control by herd immunity for sure. Okay, for example, pertussis, diphtheria, rubella, and all this resulting herd immunity have brought several other diseases under control. For example, chickenpox, mumps, pneumonia, rotavirus, Haemophilus influenza type B, hepatitis A, hepatitis B, influenza, polio, and tetanus. They're all controlled today. Some of these vaccines are given to children as they grow, while others, like the flu shot, must be administered yearly to maintain effective of the herd immunity. Study also shown that children with legitimate vaccine exemptions were 35 times more likely to contract measles than vaccinated individuals. See? Mutation and vaccines. Some of the mutations, we'll talk about mutations now, right? Some of the mutation boosted the ability of the virus to spread, which others strengthened its ability to invade the cells. The team found that the deadliest mutations were seen in the ones spread in Europe and New York. On the other hand, weaker strains were seen in some parts of the United States, such as Washington State. The tricky part is with more mutation happening, it will take some time before a vaccine can be developed. Some of the most aggressive strains of the coronavirus were able to generate 270 times the viral load of the weaker strain. Further, potent strains kill human cells fastest. However, the weaker mutation does not mean a lower risk for the populations. We really do not know yet. Okay, we are still studying about this COVID-19. Take, for example, two patients in the study in Zhejiang in China who were in their 30s and 50s had contracted weaker strain of the virus but became severely ill. Though the patient had recovered, they require admission in the intensive care units. Differences in the spike of the protein, all the spikes in the ball shape of the COVID 19, among other mutations, predicted to increase and decrease glycosylations, affect the virulence of the disease. COVID-19 mutation may become a challenge for diagnosis, test, or treatments or vaccines. There are more than 30 viral strains right now reported, but some papers, I don't know whether it's a peer review, already reached like 300 strains. The team of researchers started by Chinese scientist Professor Li Lanjuan, maybe you also heard about her name, the colleague and her colleagues at Zhejiang University in China has found within a small pool of patients many mutations not previously reported. Now, we know the COVID-19, it is an RNA virus, so more prone to changes and mutations compared to the DNA viruses. Globally, the death rate top 177,000 now, while number of confirmed cases has reached staggering 2.5 million and still more, right? The United States had some countries and some other countries, Europe, such like Spain, France, Italy, Germany, they reported highest number of cases. With many mutations occurring the virus, it may become more challenging to develop vaccine. Patients with COVID-19 are being treated in the hospital using one treatment, regardless of the strain they have. This research suggests that knowing the difference of mutation can aid in providing the right treatment to patients. Also, they can determine action to battle this virus. Do we have vaccine now? No. So what should we do to reduce the risk of infection? There are dozens of tips. Number one, avoid large event or mass gathering. Number two, avoid close contacts. Well, we now know it's about 6 feet or 2 meters with anyone who is sick and has symptoms. Number three, stay home as much as possible. Keep distance between yourself and other COVID-19s and others. If COVID-19 is spreading in your community, especially if you have a high risk of serious illnesses such as diabetes, high blood pressure, cancer, keep in mind some people may have COVID-19 virus and spread it to others even if they don't have symptoms and they don't even know if they have COVID-19. Number four, wash your hand often with soap and waters for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% of alcohol. Wear a cloth facing covering in public space such as grocery stores, where it's difficult to avoid close contact with others in the grocery stores, especially if you are in an area with ongoing community spread. Only use non-medical cloth masks because we always think that the surgical mask and N95 respirators should be reserved for healthcare providers. But I think now there are more and more already available, and we here locally also making a good N95 already. Cover your mouth and nose with your elbow and tissue when cough and sneeze, and throw away the used tissue. Avoid touching your eyes, nose, and mouth. Avoid sharing dishes, glasses, bedding, and other household items if you're sick. Just isolate yourself, okay? Clean and disinfect high-touch surfaces such as doorknobs, lights, switches, electronics, and also counters daily. Just do it daily, routinely. Stay home. If you can work from home is good, and study, from internet, And stay away from public areas if you're sick, unless you're going to get a medical care. Avoid public transportation, taxis, ride sharing if you're sick. Any immune system booster? Well, only if you are tested already that you need something. I think I will actually suggest, but I would like to add a little bit since time is approaching 30 minutes. So in my wellness pillars, okay, in my book, actually, I'm going to show you this book. You can get the book by going to my website, mariamd.com. And if you like this, you share with your friends, and then give us a good review, and you get a book for free if you come to our office. So immune system can be checked through the blood, and also lately the gut issue also affected immune system. My previous video talking about stress affect immune system, right? If all the T cell, NK cell, the one from the test are not normal and you still feel healthy, maybe you are using your reserve cell. This is when a doctor like me, like integrative medicine doctor, will evaluate and also give you the natural base booster instead of drugs, okay? Because you're healthy and feel healthy, but not in the objective finding in the blood. So basically, if you buy these food-based supplements or vitamins, FDA has a term considered as a GRAS, which is generally recognized as a safe by FDA, generally recognized as safe. Now, any supplements and food supplements or vitamins, they do not have to be approved by FDA, because only drugs has to be approved by FDA because of its side effect. But this has to be regulated by FDA. We are strongly regulated. If we use those kind of supplements that are strongly regulated, then I think it's a GRAS, or generally recognized as safe. Thank you so much for listening. And I hope if you like this one, you subscribe to my channel and share to with your friends. Okay. So let me see if there is a questions here. Okay. Go to questions. Okay. Dr. Sulindra, if percentage of people contracting COVID-19 keeps going up, how can people improve the strength of their immune system? That way, the outcome is more mild or even asymptomatic. Well, I think I did mention a little bit. Okay. So some of you are not used to going to doctors like me, because we do check the patients for preventive measures. So many of these, when the infection is going very wild, but you think you are healthy, we can test. If you're healthy, you're healthy. You don't need anything. We don't give you anything. So drink plenty of good water, and then just follow the preventive measures of good health pillars, which is detoxification. Drink plenty of water. Okay, avoid all the toxins such as I don't know, alcohol to me is toxic. Okay, I'm allergic to alcohol. Or maybe eat less fish that has a lot of mercuries that will affect your immune system, And then number 2, diet. Eat a good diet. Diet means the food you eat, okay? And then watch your nutrition. The value of the nutrition is tested, meaning that the level is tested. Vitamin D, vitamin A, vitamin C can be all tested. And then if you maintain your stress, at the very minimum level, we cannot erase stress, like I said, right? And then balance your hormone, do exercise, and all of these, you have to do it. And then the 12 things that I had suggested, just isolate yourself from sick people if this disease is still in our community. Okay, I hope that I answer. And then Because we do not and may not have a vaccine for significant amount of time. Yes, if you listen from the beginning, I had already explained that we do not vaccine because COVID-19 is an RNA virus, so it just changed and mutate. We call change as a mutate now all the time. So the people who are working on the vaccine is trying very hard to get this good vaccine for us. But I heard Moderna lab and actually AstraZeneca, pharmaceutical company, had signed an agreement with some institute lab, and they're in the phase 2 of human. So they estimate that their vaccine will arrive sometimes in September or October, but probably even if they finish the vaccine in September or October, they will make it available maybe a couple months later, so early 2021. So it is very important for us to be aware that going back to normal life, new normal, is including um, washing your hand all the time, and please don't hug yet, and then make sure you understand 20% of these people who are asymptomatic actually carry the COVID virus, and wear your mask if you go to medical office, and then keep checking your blood chemistry, and still you try to go back slowly to work if you can. So I hope the new normal, I think the new normal is a good or much better than before in terms of hygiene. Okay. So it's 30 minutes now, and I hope to see you back next week with the new topics, and we will announce the new topics. And for those who understand Indonesian, I'm asked to speak in Indonesian. It's not easy because I've been here for 40 years, but I'll try my best. And that will be at 6 o'clock Pacific time in California. Thank you so much.